Hi, everybody. My name is Ruth Benca. I'm the chair of the Department of Psychiatry, and today I'm going to give you a little tour of our facilities here on the Orange campus. I'm standing in front of Building 3, the UCI Neuropsychiatric Center, and we're located right here next to the Tower and Douglas Hospital. To my right, and the emergency department. Across the way is the Chow Comprehensive Cancer Center and some of our outpatient pavilions. This building houses some of our really important training and clinical sites. We have 3 inpatient units, 2 adult units, and 1 unit for adolescents. We also have our emergency services. We have an extension of the emergency department here on the first floor. So patients, when they are medically cleared in the emergency room right across the alleyway here, are transferred over for continued care and preparation for admission as needed. We also have sites outside of Orange. We have a new clinic in Newport Beach for outpatient services, as well as our new sleep center where we have a sleep laboratory and clinic. Okay, now we're entering Building 3. This is our main lobby where patients and visitors enter, and we're going to go upstairs to the 3rd floor to see our outpatient clinic. Here we are in one of our clinic rooms. This is a little bit different than clinic rooms that you're used to for medical purposes. We don't have an exam table in here. We have comfortable chairs and couches, and we of course have our computers for our electronic medical record. Here at the psychiatry clinics, we practice a broad range of outpatient treatments. We do, of course, pharmacotherapy and also various kinds of psychotherapies, particularly evidence-based approaches to help people deal with their psychiatric issues. We also do some newer treatments, and on the other side of the room here, you see our transcranial magnetic stimulation setup, which is a treatment that is used for disorders like major depression. Now in this clinic, and in fact in all of our settings, we treat a broad range of psychiatric disorders in patients from all socioeconomic backgrounds here in Orange County. In addition to working in the clinics that we have here at Orange and in our Newport Beach clinic, our residents train at many sites throughout Orange County, including the Orange County Mental Health Clinics and other hospitals and residential treatment facilities in the area to get a really broad background in diagnosing and treating mental illness. Okay, and now we're going to go to what's my favorite spot in this building. So here I am in one of my favorite places in this building. This is one of our beautiful courtyards. It's a nice place to kind of relax and get recentered. I want to say a little bit about psychiatry and our training programs. Psychiatry is a critically important specialty now more than ever. We've known even before COVID that psychiatric illness is the leading cause of disability, not only in the United States, but in the world. And since COVID, psychiatric issues and disorders have really skyrocketed. We have a pandemic right now in psychiatry. We have a huge spike in suicide rates, and it's really important that all physicians are trained appropriately in recognizing and managing common psychiatric illnesses, and that's one of our missions. Our medical school rotation is really popular. We're always one of the top-rated third-year clerkships, and we are also incredibly proud of the fact that students on their National Board of Medical Examiner shelf exam perform way above the national means in psychiatry. So they're enjoying their rotations and they're learning a lot, hopefully, from us. And the other thing that makes us incredibly proud is that UCI has one of the highest rates of its medical students entering the field of psychiatry. So we're really trying to create the next generation of practitioners and scientists. Speaking of science, we have a lot of interesting research that is going on here, and that's something we've really been trying to grow over the last few years. We have expertise in all the major psychiatric disorders, schizophrenia, bipolar disorder, a lot of neurodegenerative disorders, disorders of childhood related to trauma, adolescent depression, and on and on. And we try to make these opportunities available to residents and medical students who'd like to get research training. Our residency program accepts 9 residents per year, and we offer a broad range of training opportunities, of course, our inpatient units, outpatient, and opportunities throughout Orange County. We hope that this video has been helpful to you to see our wonderful resources here in the department and encourage you all to consider UCI in your future. Thank you.